Welcome to the World Organization for Animal Health Collaborative Centre for Risk Analysis and Modelling, partnership of the Royal Veterinary College London and the Animal and Plant Health Agency of the Department for Environment, Food and Rural Affairs of the UK Government. The control of infectious disease in animals and humans ultimately comes down to the understanding and management of risk. The most recent pandemic has perhaps demonstrated more lucidly than ever before the need for high quality surveillance systems, accurate diagnostics and the capacity to handle big data from the resolution of the individual genome to aggregation at the level of countries and continents. And underpinning the inference and interventions derived from these data, there must be advanced analytical and modelling techniques that are capable of forensic query and robust predictions that support effective evidence-based decision-making locally, nationally and internationally. Recognising the One Health approach to population and ecosystem health and the necessary synthesis of technical, behavioural and policy level considerations, our collaborating centre combines government agency and university sectors to provide just such a resource. My name is Stuart Reid and it's my privilege to be head of the centre and to introduce my colleagues in both organisations dedicated to maximising a risk-based approach to supporting the World Organization for Animal Health in its global mission of protecting animal health and preserving our shared futures.
As UK Chief Veterinary Officer, I am hugely reliant on a daily basis, both on risk assessments and modelling, not just for disease incidents, but also for wider policy making. And that's why I'm really pleased to support the APHA RVC WOAH Collaborating Centre for Risk Analysis and Modelling. It's a great partnership. Both institutes have a track record in impactful collaboration and high quality outputs. And it brings together in a one-stop shop both a government agency and an academic institute, offering consultancy, training, surveillance, contingency planning and outbreak response. So I'm really pleased that the Collaborating Centre can support WOAH and WOAH member countries, especially in Europe, in this area of risk analysis and modelling.
At the APHA, we undertake risk assessment and modelling for many different diseases and for different purposes, including the development of government policy, for research and also for outbreak response. In the event of an animal disease outbreak, we use qualitative veterinary risk assessment to inform decisions at both the local and the national level. This ensures that our response is risk-based. As an example, we can look at the contacts of an infected premise and we can identify those which are deemed to be higher risk and therefore more likely to spread the disease. Risk assessment that's done as part of our research activity is usually quantitative and therefore more complex. We developed a spatial risk assessment that looks at the introduction of disease into Europe via different pathways. And using freely available data, we have identified potential hotspots of infection. And this model therefore allows us to inform risk-based surveillance and to also identify potential control strategies.
Risk analysis and modelling are central to research that we carry out at the RVC to support policy and science-based decisions. We apply risk analysis to understand how the safety of food is affected by events along the food chain. For example, in India, with support from the Bill & Melinda Gates Foundation, we are developing models to assess the safety of dairy products. RVC researchers also contribute to the development of disease transmission models to inform surveillance and control of diseases such as African swine fever, brucellosis or avian influenza. To maximize the impact of our research, we build local capacity. In the last year, in collaboration with the International Livestock Research Institute, we provided training to professionals from India and Ethiopia on the application of risk analysis to food safety. To promote understanding of disease dynamics, we have developed publicly available interactive applications such as epidemics, making models accessible to non-specialists.